My son, who's an older teen, he has bipolar, so it was really, really important to make sure that the consistency with his meds and his therapy was ongoing. And then my daughter is trans, and she has very specific medications that she needs to take, and we needed to make sure that she got those medications. And then for me, being homeless at like 40, plus years of age with 2 teenagers, I never, ever, ever saw myself being that way, And it's been a super humbling experience, and has helped me as a person kind of like mature and develop and do the things that are necessary to be done to keep going and to provide for 2 people. Before Neighborcare, I was not happy with the level of care that we were getting, and needed to find a place for my kids to get their medication and services, like right away. The kids got hooked up there, they got what they needed, and then they said, we also have a clinic for adults. You need stuff too.
Neighborcare is important in helping people access healthcare, because that access is very difficult, especially in the US. Also, healthcare costs is very high. You see people sometimes working full-time, but their income is not enough to buy insurance.
When I first started coming to Neighborcare and I started meeting the staff, we just connected just like that. It was just like a family instantly coming together in a community, and you could feel the caring and the love that they had for the people and their clients.
Public health has always been a big thing for me. Wanting to help people, I think, just kind of steered me in a certain direction, and dentistry happened to be it. The thing that I've tried to tailor my care to is building a rapport really, really quickly. I try my best to smile as much as I can. I feel like that kind of transcends any language barrier that we already have. One
of the things that I like to do is to give them a warm welcome, especially when they're new. They're a very unfamiliar environment. That's the most joyful part of my day, is to see that patient comes in and walk out of here with a smile on their face. That's the best feeling you can get.
The staff are the front of the organization. They interact with our patients, they welcome them, they develop a trusting relationship with them, they begin to work on their goals and help them achieve their goals. And so our staff are the most important part of our connection to the community and to the patients we serve.
I provide nursing services or nursing care to people who are in permanent supportive housing buildings. Really, when it comes down with it, I need to be able to meet my residents or patients where they are. And they don't necessarily fall within the very strict structure that is our current medical environment. And if you don't meet that structure, if you don't fit in, you get lost through the cracks. And those are the people I'm passionate about. Those are the people I want to help. Those are the people who I can connect to on a heart level, and that's what's important to me.
She's went to the doctors with me, the clinic with me. She went through the operation with me. I had an operation about 4 or 5 months ago. Mm-hmm. And through the whole thing, she's helped me a lot. She's a good nurse. She cares, and you can feel that.
Most of our clients are low-income people or immigrant or coming from outside the U.S. So in Neighborcare, many of the employees have an immigration background, and they understand the challenges people faces when they come here for the first time.
When I first came here, I was also an immigrant. Now that I'm a little bit more knowledge about the medical work, the dental work, I want to give that back to the community. There's a fear that, what if my insurance didn't cover it? What money do I have to pay? It's very scary when you're growing up here as an immigrant and not knowing the whole process and the whole financial part in the dental world.
Medicine doesn't speak the language of our patients, and our patients definitely don't speak the language of medicine.
We are not a country that has an easy to navigate healthcare system, and working at a clinic that's able to do that for the people who only have state insurance, don't have insurance at all, I think is the most rewarding thing about working here.
Before Neighborcare, I was just feeling fatigue. I wasn't doing anything. I was eating everything. I wasn't exercising. And so after I got to Neighborcare and they found out what was going on with me, then that's when I started changing my life, and I feel great.
It's always good to know that at the end of the day you help someone fix their problem. Not just in the healthcare industry, but in any type of work. If you help someone, you feel some pleasure. You gain a pleasure about that.
From my perspective, Neighborcare fills all of my personal needs because I get health care through Neighborcare. I get mental health care through Neighborcare. When I come to a clinic, people know who I am. It feels like the relationships are real. On a bigger scale, just being a single mother of 2 kids who have these huge issues to deal with, it's like that other support person that should be in my life that isn't. That's the role that Neighborcare has taken, really, truly.
Inside Neighborcare, it's important that we really do rally together, that we do lock arms, focused on our patients. We're intent on serving the patients who need us, and we'll be here for them long into the future.